What if you or someone you know is having a stroke? My name is Lindsay Reynolds. I'm a registered nurse and the stroke coordinator at Washington County Memorial Hospital.
I'm Doug Anderson, Division Chief of Clinical Practice at Washington County Ambulance District.
May is National Stroke Awareness Month.
We are here to show you what it looks like if you or someone you know has a stroke in our community.
If you would note any of these symptoms, it's not inappropriate to call 911 for help. When calling 911, some of the things that they may ask is, when did the symptoms start, or when was your loved one last seen normal? They're going to be asking for different symptoms that they're displaying, but most importantly, they're going to be dispatching an ambulance to your home to help. Their job will be coming in to assess the patient, but also loading up to take them to the hospital. When having a stroke, it is a time-critical, time-sensitive event, so things are going to be moving fast.
Once in the ambulance, the Advanced Life Support crew will perform a detailed stroke exam, vital signs, an EKG, blood glucose, and start an IV. They may also draw blood to expedite getting laboratory values once at the hospital. If the patient meets criteria, the crew will emergently transport the patient to Washington County Memorial Hospital.
When the patient arrives to the hospital, they're taken directly to CT. It is paged overhead, code stroke. In the CT room, the patient will be met with a variety of faces. The patient's primary nurse, the doctor, the radiology tech, the lab staff, and EMS will also be present. The CT is completed first because it is our top priority in treating the patient. We want to identify which type of stroke the patient might be having. This takes just a couple of minutes at most, and once those images are obtained, they're sent to our radiologist so that they can be read. After that is done, the provider typically does a quick assessment in the room and receives report from the paramedic. And then we all work as a group to move the patient back to the hospital stretcher and off to their room. While in the CT room, a social worker will be present with any family members to discuss what is going on with the patient and to provide any resources that they may need. Once the patient arrives to his room, the commotion doesn't stop. There are multiple nursing staff that will be present to continue the treatment that is necessary. We will work on obtaining an EKG to take a look at the patient's heart rhythm to make sure there's no abnormalities. And we will also be working on getting vital signs and doing frequent neuro checks just to make sure there are no changes in the patient's symptoms. Once the radiologist has reviewed the CT images, they will contact the emergency room provider. They will come discuss with the patient and the family member what our plan of care is. For any acute strokes, we transfer them up to neurology so that they can have further evaluation and further treatment. When the provider comes in, they will explain the transfer process and if the patient is eligible for a clot-busting medication or not. The last thing that you can expect is to be loaded up by that same dedicated EMS crew that brought you to Washington County Memorial Hospital. We use a mnemonic known as Be Fast to help our staff members recognize if a patient is having a stroke. B for balance, E for eyes, F for facial droop, A for arm drift, S for speech, and T for time.
This video was created to showcase the hard work and dedication of both organizations to provide the best possible care for stroke patients in our community. After Washington County Memorial Hospital obtained their Level 4 stroke designation, leadership from both organizations came together to formulate a community stroke plan. The purpose of the community plan is to establish guidelines between Washington County Ambulance District and Washington County Memorial Hospital's treatment and transportation of stroke patients.